My name is Jeffrey Chernick. I am the Chief Strategy Officer of MedResults. We've a company that has 24 years of history globally. And the product that we're here to talk about today is our flagship product, the Plexr. It is a versatile aesthetic device that has over 100 protocols that works on all skin types. And the point of today is to really show not only the different protocols, the top 5 protocols, but really the bottom line on profit. Because while we're all in this for good reasons, we're also in this to make a living and feed our families and have a future that we're all dreaming about. And we believe, and our customers believe, that the Plexr is one amazing path to get there.
The protocols that we've picked out are the top 5, but there literally are, hundreds of treatments that you can do with this device. And that's one of the great things about it. It's incredibly versatile, can be used on all patient skin types, 1 through 6, to treat a number of conditions. And this can be something that says, mild as a lunchtime treatment that with minimal redness, minimal or no downtime, with great results, all the way up to, something that's, like soft surgery. So we're removing tissue. We're actually, we're going to show you some photos of that where we can do necks and blepharoplasties and moles and all sorts of more surgical type procedures, but do this in a setting with minimal risk, minimal scarring, and minimal downtime. Now, this is the part that I get really excited about, the soft surgery. So not that I don't love all the other stuff. Our estheticians do it. Beautiful results. Patients love it. What I personally love performing, and I literally could probably just do it all day long, it's addictive, is these soft surgeries. So things that we can do to really remove unwanted tissue. Now we're going to show you something like a neck lift. How many of you struggle with that in your practice? As many things as we can do for patients' faces. Again, with the neck, we're always struggling to try to keep that up. Oftentimes we can look at a patient's face, they look phenomenal. We look at their neck and you can tell their age, their neck and their hands, right? And so this also gives us an option. And so I would say before this device, I wouldn't even attempt something like this. It's for sure surgery or no treatment at all. Now I'm giving them options. It's like, maybe they're still going to need some kind of lift or surgery. I'm not saying you're going to always avoid surgery, and it's going to be important for you to know when to refer out for surgical options. But I can tell you with the Plexr device, it gives you a lot more power, a lot more tools to work with to do some of these procedures in your med spa setting. If you can give your patients these results, they will be your patients for life. You can back off on your marketing because they're going to tell all their friends are going to tell their friends, and they're going to do the marketing for you just because of these amazing results that you'll be able to get with this device. Now with this, there is a little bit more downtime. Clearly, when we're doing treatments like this, it is ablative. So we have other protocols that we'll go over that are semi-ablative, we go from the shower being non-ablative, no downtime, immediate, return to activity, to some of our semi-ablatives, which is a few days downtime, to more of this fully ablative that's going to be, maybe 10 days or so that they're going to have before they can look like they haven't had anything done or been mildly red. And so, the more aggressive that you're going to be with that, usually the more that you're going to charge for these procedures. And so something like this may take a couple of sessions and you're going to charge a few thousand per session. Your disposable cost on that is actually even less than the shower. It's going to be around $10 to $15. So you're not going to have a lot in your disposables, but because of that result, I mean, if you give the patient that result, they're not going to argue with you about the price because they would have paid much, much more for that if they had to have a surgical intervention.